So today we'll be comparing very interesting drugs, that is Vildagliptin, which is from gliptin, and Metformin. Now, this Vildagliptin is DPP4 inhibitor, so that is dipeptidyl peptidase inhibitor. Which what does this DPP4 does is it actually breaks down the GLP, that is glucagon like peptide 1. So there will be reduction in GLP-1. So by inhibiting this DPP4, this vildagliptin actually increases the level of GLP-1. Now, what does this GLP-1 does is it whenever we eat, whenever the patient eats food, so depending on the level of the food, depending on the level of glucose which is released, it causes increased release of insulin physiologically, and it reduces the level of glucagon. So this is the effect of this GLP-1. And very commonly this DPP4 inhibits this GLP-1 or reduces the level of GLP-1. So by inhibiting this DPP4, automatically there will be more GLP-1. So automatically there will be a better physiological insulin release, and there will be suppression of the glucagon. That is how it can beautifully control the sugars. So this is the effect of vildagliptin. Whereas with metformin, actually it does not cause any insulin release, but actually in sense it causes suppression of the hepatic gluconeogenesis, and it enhances the insulin mediated glucose uptake. This is how it improves the insulin sensitivity. So it does not have a GLP-1 or DPP4 inhibition activity at all. The additional benefit of this metformin, apart from improving the insulin sensitivity, is that it causes enhanced fatty acid oxidation. Hence, it also improves the lipid profile. So, if the patient has sugars, high sugars, as well as it has some cholesterol abnormality or lipid profile abnormality, then metformin can definitely cause better maintain the lipid profile as well as better maintain the sugar control always. Both the drugs, that is vildagliptin and metformin, cannot cause hypoglycemia on their own. So if they are used isolatedly, this cannot cause hypoglycemia. But if these drugs are used with glimepiride or gliclazide or insulins, then they can definitely enhance the hypoglycemia, or they can cause hypoglycemia. One of the main difference between this gliptin and metformin is metformin causes weight loss. So the patient may have weight loss of up to 3 to 4 kgs, whereas gliptins or vildagliptin, they are completely weight neutral. So they won't cause any weight gain. They won't cause weight loss. So if the patient is obese, this metformin definitely has an edge to cause weight loss. One of the important thing with metformin is it very commonly causes satiety also, and reduction in the appetite is very commonly seen with metformin, whereas with the vildagliptin, this reduced appetite is not seen. Also, this metformin very commonly cause nausea, gastritis, indigestion, bloating. So gut-related side effects are slightly more common with metformin. Though most of the time we can continue this drug, in few patients we may need to discontinue the drug because of the very much nausea, vomiting, abdominal pain, epigastric pain. But in around 80 to 90% patients, the patients can tolerate these side effects. When we continue this drug for more than 2 weeks, these symptoms markedly reduce. So this vildagliptin can be used once a day or twice a day very commonly. We can use this drug 50 milligram twice a day or 100 milligram once a day also. Whereas metformin is very commonly used in sustained release depending on the HbA1c level. It can be used once or twice a day also. So this vildagliptin very commonly has hepatic metabolism, and 25% of this drug is excreted unchanged in the urine. That is the reason why Vildagliptin, the dosage has to be reduced if the patient has moderate to severe uh, kidney disease or liver disease. Whereas metformin, on the other hand, very commonly causes lactic acidosis if the patient has any organ failure like heart failure or liver failure or kidney failure. So if the patient has moderate to severe liver disorder, moderate to severe kidney disorder, or moderate to severe any other system failure, then in view of this acidemia, this metformin should be reduced in the dosage. Particularly, if the eGFR is less than 45, we have to halve the dosage of the metformin. And if the eGFR is less than 30, then it should not be initiated at all. If the patient is already on metformin, then we can definitely reduce the dosage to half and we can continue the metformin. One of the best part of this metformin, it has shown to prevent the macro and microvascular complications like nephropathy, like retinopathy, cardiovascular, coronary artery diseases. So this is one of the very important drug for all the diabetic patients who are diabetic, who want weight loss, who want their insulin sensitivity to be better, and who want to prevent micro and microvascular complications of diabetes. The HbA1c reduction of the vildagliptin into patients using vildagliptin, they can have a HbA1c reduction of up to 1.5, whereas with metformin it can be slightly better and the HbA1c reduction can be seen up to 3 also if it is properly used with diet and exercise as well. This vildagliptin is very commonly combined with metformin, very commonly combined in a triple drug combination with metformin and SGLT2 inhibitor with like empagliflozin or dapagliflozin also. And if the creatinine clearance is less than 50, the dosage of the vildagliptin which is used is 50 milligram per day. So this was almost everything about this vildagliptin and metformin. With metformin, metformin can very commonly cause reduction in the absorption of vitamin B12, B6. So it can actually slightly worsen up the peripheral neuropathy. So whenever we are giving metformin, we should make sure that the patient also receives vitamin B12, vitamin B6 supplements at least intermittently in between. So this was all about metformin versus vildagliptin, and there will be much more such topics coming ahead in the time. Thank you.